702.
Health and wellness.
Time for our health and wellness feature now, 22 minutes before 12 o'clock. And today we are discussing cosmetic facial procedures like your Botox, for instance. This was something that was seen as a luxury reserved for your Hollywood celebrities, right? But actually, these kind of procedures like Botox have become increasingly common here at home with people from different walks of life seeking it out. Are you one of those people who have done a cosmetic facial procedure? And how did it go? Because for some, it's all about reducing wrinkles and maintaining a youthful look. But for others, Botox has medical uses, right? Some people say it helps them to treat conditions like migraines, excessive sweating, and even muscle spasms. But as demand rises, so do the questions around safety and accessibility, but also the issue of affordability and the social pressures that are driving people, particularly women and even younger South Africans, to consider these treatments. So even these cosmetic facial procedures, are they simply a beauty trend, or do they actually reflect something deeper about how we see ourselves and how society values appearance? So, have you done a cosmetic facial procedure like a Botox? How did you go about doing it? Where did you do it? And how did that go? Are you happy with the outcome? Let me know, please. Give us a call or send us a WhatsApp voice note. Dr. Maureen Allem is an aesthetic doctor who's going to guide us through this conversation. Dr. Allem, thank you for making time. Good morning.
Morning, Clement. Thank you for having me on your show.
So I just, learned something from my producer this morning, and I want you to explain it to the listeners because I think it's a moment just to educate, right? Botox is actually a brand. So cosmetic facial procedures, Botox falls under that as a brand of its own. Whereas many of us have always thought when you talk about Botox, then that just means the procedure itself.
Yes, absolutely. Botulinum is a Schedule 4 medical drug, so it's very difficult. And to actually mention the word Botox, you actually have to use wrinkle relaxers, neuromodulators when you're speaking, to the press and that. As a medical doctor, you cannot actually use that word. So we call it an injection, or we call it wrinkle relaxers or neuromodulators.
Interesting. Okay, so when we talk about things like Botox or the cosmetic facial procedures, what exactly are most South Africans doing those procedures for? And have you seen the use of these procedures growing in South Africa over the past couple of years? Because it at least appears like that to me.
No, absolutely. I first started doing botulinum at the end of the year 2000. I think there were only about 5 medical practitioners in South Africa doing these injections. And I came upon it it was a great moment for me. It was an aha moment for me when I realized what this injectable could do to make someone more approachable. Because a very high profile person in South Africa was known to be a very troubled person. She looked very troubled because she had these deep forehead wrinkles. And then, I think in one of her overseas trips, she went for this injectable treatment, and it changed her whole demeanor. She looked more approachable. So when I read that in the magazine, I thought, wow, this sounds like an amazing treatment to do. And then obviously I went and I looked for it, and I found a plastic surgeon at one of the big hospitals, and I went with 4 of my sisters, and we all had the treatment. And it was quite incredible how it just changed a person's look and how it made you feel. So that is why I think most people want to come for the injections. It just, it's not vanity. It gives you vitality. When you look in the mirror, you see the person that you want to see. You don't see this tired, cross-looking person.
Yeah.
So that's why it's so popular.
Okay, who's seeking these treatments more, doctor? Are we seeing more young people turning to it much earlier, or is it still mostly, popular among the older age groups?
Look, usually the older age group, but it's not a magic age group when you should come for this injectable. So when you look in the mirror and you see these fine lines appearing between your eyebrows or on your forehead or around your eyes, that's when, people come in and do the treatment because they want to just modulate this expression and prevent those deep wrinkles from forming. So it could be we have a patient in their late 20s, but it's usually in the early 30s and 40s, and sometimes even, the decade of 50, that patients come in wanting to just look better and feel better about themselves, because it definitely gives you confidence. And we know that by injecting, this neuromodulator, it actually modulates the limbic system, which is your emotional processing center in your, your limbic system in your primitive brain. So it has amazing benefits as well. And I think there was a study that was published that it actually lifts depression. So the many numerous benefits from having this injectable treatment.
And beyond the aesthetics, what are some of the medical uses of these injectables that South Africans might not be aware of?
Okay, so what it's registered for, FDA approved, is to help migraines, to help prevent migraines, from happening. And they're not quite sure how it happens, whether it's the peptide that modulates, the migraines in the brain, or whether it does something. They're not quite sure what it does, but definitely helps depression. We have patients coming in who've got pain in their jaw, their jawline, in their major grinding muscle, the masseter. And it's life-changing when you give, targeted injections into this muscle. And within a week, they start feeling the pressure receding. And by relaxing that huge biting muscle, you not only, feel better, by relaxing the muscle, you actually protect your teeth. Because when you grind with force, you cause these tiny micro fractures in your teeth, and eventually with time, your teeth start cracking up. I'm sure, as you get older, you have to go to the dentist more often because you've got these micro fractures, especially if you grind your teeth at night or even during the day. So that's what it does. It just releases the pressure on the teeth, so definitely for bruxism. And then another one is for, excessive sweating, under the arms especially. And that can be life-changing for a person because, they're very limited to what they can wear because they get these large white, sweat stains. So by doing the injections in the armpits, it's amazing. Within 2 weeks, their life has changed because they're not sweating as much. And this usually comes from heat. But more importantly, I think it comes from stress, especially when they have to go give a presentation. And that's when, when the adrenaline starts pumping, that's when you really notice that they start, they start perspiring.
Yeah.
It's that. And then, so spasms, for cerebral palsy children, they do the botulinum injections to relax the muscles. So there are many medical indications for botulinum. And it all started for around the eyes. When people have got a condition called blepharospasm, which means that you blink uncontrollably. And you blink so badly that you actually become functionally blind. And that's how this whole miracle drug was discovered by an ophthalmologist who used the botulinum to help her with her blepharospasm. And then the patient came back and said, doctor, look how amazing my wrinkles are. I've just got this amazing expression on my face. And that's how it all started.
Okay, I see. All right, Dr. Allem, I've got some questions from listeners that I want to give them an opportunity to ask and some inputs as well. Salome in KZN, I see you. I'll come to you in a moment. Dr. Nandi in Parktown North, I see your call as well. I'll start with those after the break.
702 Health and Wellness.
10 minutes now before 12 o'clock. Let's go straight to your call. Salome in KZN. Hi.
Hi, Clement. I just wanted to find out, in terms of qualifications, when I go for consultation, who can actually do these injections? Because sometimes you find out that the GPs or somebody at a spa treatment, they actually say, no, you can come in for 250 whatever mils of an injection, come through, and then you can do this. How safe is it? What should I be looking for when I go for consultation?
Yeah, great.
Any kind of qualifications.
Great question, Salome. Thank you for that. Dr. Allem?
No, absolutely. You have to be a qualified medical practitioner or a dentist. Those are the registrations that are allowed to do botulinum injections. And you have to have training. I mean, it's very nuanced where you put the injections, so you can have if you do too deep in certain areas, you can have an eyelid drop, your eyelid drops or your whole brow drops. So it's very important that you go to a proper medical clinic that has doctors on site when you do your botulinum injections. I know there are many places that are offering, cheaper botulinum treatments, but it's all about price, safety, and results. And if you go for price, you might be compromising safety and results. So it's very important that you go to a proper medical practice to have your injections. And the medical practitioner has to be extensively trained on botulinum injections. So at our clinic, Skin Renewal, our doctors train for 3 months before they even see a patient, a live patient. So it's, that's what we pride ourselves on, extensive training, ongoing education. That's what's so important, because in the wrong hands, it can go wrong. You know what I mean? And it can look fake, but in the right hands, it looks amazing. Your look is invisible. You just look, you have that amazing expression, and that it looks like you've been on holiday. And that's exactly what you want. You want patients to think that you're so rested and you look like you've been on holiday.
Got it. All right. Dr. Nandi in Parktown North, hi.
Good morning.
Hi, Dr. Nandi. Go ahead.
Yes, I just wanted to share my experience. I'm actually an aesthetic doctor. I've been doing this for about 7 years now. And the clients that I've treated, it was about anti-aging, where they wanted to get rid of the wrinkles. Especially the one that's bothering most people is that line, that vertical line between the eyes, whereby you look angry all the time. And that drooping eyebrow, because when your eyebrow is lifted at the end, you look, like happy all the time. And then my clients have also been happy with treatment done for migraine. Migraine, it helps a lot with migraine, as well as excessive sweating, either on the forehead or on the armpits. And I must say that I've had a very, very, very happy clients, using the toxin, the botulinum. Yeah.
Okay.
Yeah.
That's and mostly, Dr. Nandi, in your experience, is it mostly women coming to you? And is it do you have younger people also taking it up much earlier?
Actually, when I started this aesthetic practice, I thought I was going to be dealing with, I'm almost 70. I thought I was going to be dealing with middle-aged or elderly women, but it's the span from 20 to 45 that is mostly my client, because they want to enhance their looks. They can afford it. It's these young executives, up and coming, self-employed, some of them, and they just want to improve their looks. They want to look younger and thereby enhancing their confidence. It's actually something I did not expect, because things like the anti-aging has been labeled as a snobbish thing for rich, American women and so on. But most of my clients, and it's both male and female, and in particular the LGBTQ community, I have many clients from these young guys, in marketing. Yeah.
Amazing. Yeah. Thank you, Dr. Nandi. Thank you so much for sharing that experience with us. I appreciate the call. Dr. Allem, I'm getting really some questions about what consumers need to be aware of. And I know Salome asked that question about how people should be qualified, but what advice do you give to our listeners who really want to try this out, but they want to make sure that they do it in a safe manner with a reputable practitioner, and not someone who's unqualified?
Yeah, like I said before, Clement, it's price, safety, and results. So do your research. You can go online. You can see before and afters. Very often it comes, most of our patients come from word of mouth. Patients saying, go there because you're going to get a great treatment. It's going to be a great experience. And to make sure that the clinic that you go to, there's feedback. Like the next day, the manager should phone and say, are you okay? And in 2 weeks' time, they'd follow up again. And then also to have a follow-up treatment after 2 weeks to see exactly, especially if this is your first time that you've had these injections, to see whether it's perfect. And then we make a note of exactly where we injected, which we have from the first appointment, and then we can modify that with a follow-up appointment. And then the next time you come, it's pretty simple. We have the template for where to inject, and the nuances that have to be taken into account. So do your homework, do your research, go online, look at all the different clinics, and see and also we have a live chat which you can go online to and chat to qualified people who will explain what it's all about.
Got it. Dr. Maureen Allem, we're out of time, but thank you so much for that. She's an aesthetic doctor. It's 4 minutes now before 12.